practice to illustrate just how transformative even the simplest research-backed inventions can be. Let me take you back to the 19th century to a French young physician named René Laennec. At the time, diagnosing cardiac diseases involved a doctor putting their ear on a patient's chest to pick up the heart sounds. However, that was a little bit difficult for doctors to pick up heart sounds, especially in patients that were overweight and very ill. It was quite difficult. So in 1816, Dr. Laennec observed children playing with long, hollow wooden sticks to amplify sound. Inspired by this, he rolled up a piece of paper into a tube and placed one on a patient's chest and the other on his ear. What he heard amazed him. He was able to pick up heart sounds from that hollow tube, and that's what we call today a stethoscope. What began as a moment of curiosity, driven by problem and a bit of imagination, has become one of the most iconic tools in modern medicine today. And yet, it's not the stethoscope that we celebrate. It is the research mindset behind the invention. The willingness to observe, question, experiment, and share findings with others. Today, we are called to embrace that mindset. As emerging health threats become more complex, research is not just helpful, it's essential. It lights the path ahead and provides the data to make informed decisions. It ensures that the medicine of tomorrow is better, safer, and more accessible than it was yesterday. Throughout this event, we will hear from brilliant minds who are leading the charge, exploring innovations in diagnostics, therapeutics, public health, and beyond. Let us be inspired by their work and reminded that we all have a role to play in advancing medical research, whether as students, scientists, clinicians, and advocates.
Okay, thank you very much. I would like to believe we got one or two things from that. So before we can introduce our speakers, I'd just like to express my sincere gratitude to UNZAMEDSA as well as One Day Africa for organizing such an event, which I believe is going to be a great success. And not just a success, but also going to impact and influence our perceptions as well as how we see research. Because I think a good number of us see research as something very technical and something very complex, but hopefully through the inspiring stories and through the great experiences that we're going to hear today, we're going to be ignited in one way or the other to pursue research. So without further ado, I'll introduce the first keynote speaker that we have, and this is none other than Dr. Masauso Moses Piri. So I'll read his bio first so that we know who Dr. Masauso is before we can have him come to the stage. So Dr. Masauso Moses Piri holds a PhD and master's degree from Northwest University in South Africa. He's a lecturer at the University of Zambia School of Medicine and an alumnus of several research fellowships, including the U.S. National Institutes of Health NIH Fogarty Insight Fellowship with the University of Maryland, Baltimore. His research interests align with developing innovative health interventions such as therapeutics, vaccines, diagnostics that can combat disease burdens prevalent in African region, including HIV. His experience as a vaccinology research fellow in the WHO TDR Clinical Research and Development Fellowship in Germany provided him with invaluable knowledge on research and development, including discovery of active agents or target particles, the early clinical development, and other cross-cutting projects aimed at accelerating and de-risking vaccine research and development. Lastly, as a faculty member in the Department of Pathology and Microbiology, his focus is on teaching chemical pathology to undergraduate medical students and mentoring postgraduate students. Ladies and gentlemen, let's give a round of applause for Dr. Masauso.
Introducing our second speaker, our very own Dr. Melody Asukile. Dr. Melody Asukile is one of Zambia's first neurologists. She completed neurology residency in 2020 at the University of Cape Town, UCT, South Africa, with a distinction in her thesis. She became Zambia's first She became Zambia's first epilepsy specialist after a clinical epilepsy fellowship at UCT, funded by an education award from the International Federation of Clinical Neurophysiology. She serves as University of Zambia lecturer. She serves as a lecturer at the University of Zambia and consultant neurologist at the University Teaching Hospital's Adult Hospital in Lusaka, where she directs the National Electrocephalography and Electromyography laboratories. Currently, she is pursuing a PhD at University College London, funded by a scholarship from the Mandela Rhodes Foundation and the Leverhulme Trust. Her research is focused on exploring ways to improve epilepsy diagnosis and management in resource-limited settings. She is also very passionate about education and is interested in exploring alternative methods of education. Ladies and gentlemen, let us give a round of applause for Dr. Analo.
Last but not the least, we have Dr. Chihena Banda. So Dr. Chihena Banda is a plastic and reconstructive surgeon currently serving as head of plastic and reconstructive surgery at the University Teaching Hospital and lecturer under the University of Zambia School of Medicine. He completed his PhD in plastic and reconstructive surgery from Mai University in Japan, following the award of a Japanese government mixed scholarship. Dr. Banda is one of a select few plastic surgeons in Africa specialized in microsurgery, which is an advanced technique used to repair small vessels and nerves using an operating microscope, allowing surgeons to reattach completely amputated limbs or organs such as the penis, as well as perform free tissue transfers. He has since established the University of Zambia Microsurgery long CVs, eh? Yeah. So he has since established the University of Zambia Microsurgery Training Center, a dedicated surgical skills lab in Zambia, established in collaboration with the Rotary International University of Zambia. Ladies and gentlemen, let's give a round of applause for Dr. Chiona.
Thank you so much I'd like to thank all of you for making time to come and mentor us about research. So to start with, we'd just like to ask you a question that you should answer within 30 seconds. So we want you to tell us which academic or non-academic book that has shaped your life in any way. So just the title of the book and why, just in 30 seconds, especially non-academic.
So I remember reading A Long Walk to Freedom. Those of you who've read it, by Nelson Mandela. Teaches endurance and upward thinking. Don't think short term, think long term, and stick to your goal. Nice book.
That is so interesting, Dr. Bana, because even I was going to say Long Walk to Freedom. And to be honest, I didn't read A Long Walk to Freedom deliberately, but I was applying for the Mandela Rhodes Scholarship for my master's. And so I thought the only way I can get a Mandela Rhodes Scholarship is I should read Long Walk to Freedom. But it really taught me a lot. And there are like certain quotes in there that have really spoken to my life. I think one was just where he was saying like, a little slights, a little indignities, and that like drove a passion in me to make a change. So it just really made me think like, there are little things along the way that just drive you to say, I need to make a difference. So yeah, Long Walk to Freedom for me as well.
Yeah, I haven't read The Long Walk to Freedom, but mine is The One Thing. So the title of the book is The One Thing. And the point of the book is saying you need to focus on one thing that can change everything in your life. So I think that helped me a lot, especially during PhD years when things are very tough and you're wondering, should I stop doing this or not? It keeps your focus. So your one thing right now is finish your education, nothing else. Yeah.
Okay, very impressive summaries of books. I think it's very hard to summarize a long book in just a few sentences. So we'll dive straight into the questions that we have for our speakers, and afterwards we're going to have a series of, we're going to have an open session for Q&A. So if you have any questions, anything that you take note of that you'd like to ask, you can just take note of it and then we'll address it. So the first question goes to Dr. Melody Asukile, and the question reads, what opportunities exist for medical students to start engaging in neuroscience-related research within limited resources?
Thanks, Emmanuel, for that question. Before I start, I haven't had the opportunity. I just want to say thank you so much to the students, to One Day Africa for having me here. It's really an honor because when I was a medical student, I was Unzametsa president, so I'm just so proud to see this happening. I'm so proud that Unzametsa is still going, which is really great. So thinking about opportunities for neuroscience research, I think this is really important because looking back at my own trajectory in life, I was interested in research, but it took so long for me to actually identify the opportunities. And I think the time is now, when you're a medical student, to start thinking about this. And research doesn't just mean like you're in the lab, you're only studying. Research is also about being a doctor, thinking about questions that you can answer, describing what you see. So I think at a medical student level, the first thing I would recommend is you should start locally and start small. So one of the opportunities you have is when you do your 6th or 5th year research project. So start there. It's a small project. Usually you're either describing cases or describing a certain condition, but take that seriously, learn from that, and don't think you have to change the world from your research question, but you can answer a specific question when you start. So think about your research project. As a medical student, I also encourage you to engage in research. So there's lots of research going on by us, for example, by other colleagues in the hospital, by Master of Medicine students. I think that's how I started. When I was 6th year, I would find MMeds who are doing a project, become their research assistant, and you start learning about how research goes. So those are the things that you start thinking about. And then now you start taking opportunities. So when you participate in a research, ask, how can I produce something out of it? So write a case report, present it at the ZMA meeting, locally for a start, presenting at national conferences. Then you also start thinking globally. So a lot of international conferences, especially in neurology, for example, American Academy of Neurology, the World Federation of Neurology, European Academy of Neurology, they always have travel grants. I'm serving on several scientific committees where we're choosing abstracts, and to be honest, the threshold for selection is really, really low. You just need to apply, and your chance of selection is higher. Of course, you need to make a bit of effort in your application, but then when you get accepted for the abstract, then you apply for a travel grant, and it all starts there. So why that is important is, as you go forward, that track record of the research activities you've done, they make a difference as you're applying in future. Thinking a bit forward about early career grants, so those are now funding opportunities to do research. So sometimes with the university, there are some small grants which can be awarded to lecturers, and lecturers can adopt students as part of those grants. And then on a more international scale, for example, I'll cite one organization where I was a recipient, the Royal Society for Tropical Medicine and Hygiene. So again, this is really a blanket type of organization. So it's really covering tropical medicine is Zambian medicine, it's African medicine. So meaning that you can do a project in any area really related to tropical medicine. So those are some of a few suggestions.
Thank you so much for that response. I hope we've gotten one or two things and have our questions ready. So our next question is to Dr. Piri, to Dr. Masa also Piri. In your opinion, what role can medical students play in laboratory-based or diagnostic research during their undergraduate years, and how important is it?
I think the important thing is identity. So if you identify yourself as an upcoming clinical scientist, then you see the importance of doing research in every sphere, as it were. So an example is that I'm doing this NIH fellowship, and two of my mentors are a professor, he's a clinician, but his work is in basic science. So he designs and develops immunotherapies, antibodies, and neutralizing antibodies to treat HIV and different diseases. And the beauty of being a clinician and also doing basic science research is that you've got the advantage of seeing the clinic, and so you can work backwards. So it's important for medical students to get involved in basic science research, laboratory-based research, for a number of reasons. One, you can actually learn how to correlate results to presenting clinical features, symptoms, and whatnot. You can look at discrepancies. You can also think about developing new techniques of doing things better. And so it's important to start early and to start now, because if you see yourself as this clinical scientist, then your sphere is greater than just doing clinical work. If anything, I'm sure Dr. Banda would also agree, and Dr. Melody as well, clinical work can only go so far. Basic science goes deeper and deeper, and if you're going to come up with any therapies, diagnostics, vaccines, you need to go into the basic science. You have to understand that, and that's where the crux of the matter is. Lastly, if I may put it like this, it's you want to differentiate yourself from being a technician. A technician is a guy who gets a hammer and hits something, right? And so if you have the treatment guidelines, you know what to give. You can't be innovative about giving 2 doses of Panadol. But you can be innovative in going backwards in understanding what works better, which therapeutic can work better, how can we modify that. So it's important to get into the basic science in laboratory-based research.
All right, thank you so much for that, Dr. Puri. So the next question goes to Dr. Banda, and here goes the question. How has research in plastic and reconstructive surgery evolved in the last decade, and how is it shaping patient care today?
Thanks so much. I would like to first, thank Unzametsa and One Day for this invitation to speak to all of you. It's a huge pleasure to give back and share back my experience. I wasn't in Unzametsa, but I was in Unzasurgery. We were crazy in that time. Anyway, so plastic and reconstructive surgery, especially in Zambia, is a new field. Very few people know about what a plastic surgeon does. Maybe some may know about burns and things like that. But research in plastic and reconstructive surgery is important. And my 2 colleagues have talked about basic science research and investigative research, but there's also another wing, and that's clinical research. And those of you with an interest in surgery, this is a lot of what we do. So it comes through by observing what you've done, or observing your patients, observing what works, what didn't work, and building on that, okay? So my personal research in plastic surgery, I do a lot of both basic science as well as clinical research. So basic science, I studied using a newt, salamander, because these are able to regenerate without any scars. So we are able to replicate those models and see how we can improve wound healing in actual people. So there's a huge scope, both in the clinical side and the basic science. And like Moses put it, what makes you an impactful individual as a researcher is when you're able to combine these 2 perspectives to build on patient care. So plastic reconstructive surgery is growing. And the nice thing about it is that very few people know about it in Zambia. So there's a lot to bring out to our community. Yeah.
Thank you so much for that response. And it's good to learn that we are actually dealing with some politicians on the panel. Yes. Our second question goes to Dr. Sukile. So how can a student stand out when applying for research grants?
Thank you very much, Dora. So how do you stand out? I think for me, there are 3 tips that I have for standing out. The first thing is when you're choosing a research topic, try to be as specific as possible, and then at the same time, keep it simple. So as I've said, it's always important to learn that in research, it's like a big ocean, and each of us are just adding a little drop. So especially when you don't have experience, don't imagine like the biggest, most complicated questions. Simplify it as much as possible. And then they always talk about making something smart. We hear that a lot from politicians and everyone else. But where it's specific, it's measurable, it's achievable, it's relevant, and it's time-bound. So that should be very clear in your application. So a simple question with a relatively simple answer that you're looking for is what you should start with. The other thing that I noticed that's a big issue when people are applying for grants or for any program is that they don't read the application guidelines. Read the guidelines, see what they require from you. As I was saying, whenever I apply for a scholarship, I read about the organization, I read what they're all about, and that's why I read A Long Walk to Freedom, because I knew this is an organization about Mandela, so I really wanted to, even when I wrote my essays, it had to be really informed. So read the guidelines, make sure that you are answering the question being asked and you're answering it appropriately, include the information that needs to be included, because it's those little things that gets you excluded. And lastly, as I said, have a long-term goal. I think my colleagues have spoken to this. So when you are starting applying for a grant, think about the future. Where do I want this grant to take me, for example, and where do I want to see myself? So for me, for example, if I want to apply for something maybe in 2 years, I'll start thinking now, what should I do to prepare myself for that? So that's like this scholarship with my PhD. 2 years back, I started thinking, what steps should I take to get there? So even now, if you think you want to do grants in future, so start doing those little things I was talking about. Participate in research, write case reports, so you build a CV for yourself so that by the time you apply for something, you have the qualifications you need for it. Thanks.
All right, thank you very much. That gives me a lot of hope because at least I know it's not too late. Can work on an abstract or a case report or something like that. So the next question goes to Dr. Masao Sopiri. How important is publishing as a student researcher, and what advice would you give for getting a paper published?
Yes, so it's very important. It's really, really important. And just to backtrack a bit, I mean, how do you stand out as a medical student in research? One of the important things is have a mentor. Look, get someone who's already doing something you really want to do. Like association matters a lot, even in publishing. How do you get started? It's get a mentor, because the people you associate with eventually end up to being like them. So one of the examples is I have a mentee of mine. He finished his 7th year here. But before he finished, we would involve him in some research. And when he was about to finish, you know, he came to me with the Royal Society advert and says, can we write a grant together? And we discussed the idea. We wrote, I was a PI, we got the funding, £5,000. We did the work together, writing the paper. And that put him on a trajectory where before long he got a scholarship to go do his master. So he didn't even finish his internship. He went to Bergen and Norway, I think. And then when he was just finishing his master's, he got a scholarship for his PhD in the US. So he called me again, do I take it up or not? I said, just go, you know, go. So as we're speaking, he's obviously getting a bit of weight in the US, but he's doing really well. So get a mentor. So it's important to publish, because when you publish, you're visible. People can search you and see what you've done. You've got those projects you do in your 5th year now and 6th year before. I am the, what am I called now? The School of Medicine Research Ethics Committee Chair for the undergraduates. And I review a lot of these research topics. Some of them are artisan practices of sexual issues at Ridgeway, medical students, depressive syndromes, things like that. But those research are really good enough that you can actually publish a paper from there. So you work with your supervisor and turn that research into a publication. Even if it's the Zambia Medical Journal, put it in, publish. By the time you're in your last year, at least you've got a publication. So start now. Review papers. You know, you can use all these, but one important thing is find a senior person, tag along, and you'll find yourself way ahead.
Thank you so much for emphasizing that we need mentors. I don't think I could have published my paper if I didn't have a mentor. So the next question goes to Dr. Chihena Banda. So Dr. Banda, for students interested in surgical research, what kind of small-scale or student-led projects would you recommend starting with?
So my first recommendation is start with a case report. So a case report is a simple description of just one patient, okay? And it teaches you the skill of observing, following up, and reporting what happened to that patient. The other thing is that, you know, there are few ethical barriers. You're just explaining what happened to the patient. And you can easily publish it. So it will teach you the skill of writing, it will teach you the skill of following up a patient. So for those who are wishing to go into clinical research, that is the #1 starting point. Why? Because usually clinical research is a bit expensive and you need a lot of time to follow up. You don't have those when you're just getting started. But it shouldn't be a barrier for you not to get started. So write a case report. And you also don't need to wait until you are, a fancy doctor somewhere or a professor. No, that's actually too late. The best time to do it is now. And also, you guys are at a very, very advantageous point because, literature is available everywhere. When we were doing our undergraduate, it was very difficult to get into a journal. You didn't have so much information that you had today, okay? But you have all that. There are so many journals that are available for you. Then, as it has been spoken here, whatever you publish this time is a stepping stone for your future, okay? Every time when we were accepting PhD students, that's in Japan, the first thing that we do when someone applies is we go on the internet and check what is their name. And sometimes you find some people have some research, a case report. It shows you, yeah, this person is really good. Especially in Africa, they respect that because they know we are in a resource-limited setting. We don't have everything available. But if you've made time to do something, it shows you have the ability. On the contrary, when we Google someone and the only thing we find is disco pictures in Facebook, it shows a bad image. This person is playful. Again, it brings up another tip. Dr. Sukile talked about it. Start thinking ahead. If you plan a career in academia, you'd like to clean up your profile, focus on on getting those case reports written. Yeah. Then lastly, I think maybe something I wanted to mention earlier. My strong belief is that research or becoming a researcher, it's like, I tell this to my MEd 1, MEd 2, it's like riding a bicycle. The best way you can learn how to research is to research, okay? You will never learn it by just reading. We all go through, I think it's 6th year, we had that course in research. You know what a quasi-randomized, you read it, write the MCQs in the exam, you've passed. But at the end of the day, if someone was to tell you, can you answer this research question, do the research, you can't. So the best way to start is to go ahead and actually start doing the research. And the case report, for those who are interested in clinical sciences, is the best starting point. If you don't know where to start writing a case report, come to my unit. I'll give you enough patience.
All right. Thank you very much. That was a sobering reminder. So it's important for us to clean up our digital footprint. If your name is that dope chick or anything like that, you might want to realign it to a professional tone. So the next question goes to Dr. Skile, which should be our final question. How can students choose a relevant and impactful research topic that aligns with personal interests and health system needs?
Thank you, Emmanuel. So I think that question, it's got multiple things that one has to consider. I think, as Dr. Masa also said, Dr. Banda, you do want to start with thinking about what interests you. So science is very broad, and it's all interesting, and there's always something that we need to know about something. There's no one field where everything is known. So I think first start with yourself and say, what do I find interesting? And then when you identify that, then now you start thinking, in this field that I find interesting, what is known, what are the questions still remaining to answer, or from yourself, from your observations, because I'm a clinician, I'll talk about the hospital. You go to the hospital, you've seen a certain trend or patterns happening to certain patients who are getting a certain treatment, having certain outcomes. So you start asking those questions. However, again, as has been said previously, it's very important to have a mentor. So you have those ideas to say, okay, I'm really interested in this. Look around you in your near proximity, your senior students, your lecturers, who might be able to guide you in some of these interests. Because it's very nice to say you want to be a researcher, but research does have a method to it. And it's also got like rules, I would say, in a sense. So you do want someone who can guide you. And so when you go, and I think several students might have come to me and say, I'm interested in this topic. What research question do you think? Or this is my question, how can I refine it? And I think that's really helpful, because it helps you, as I said, make your questions smarter and more achievable, and answer questions more practically. I think the last thing is you also have to do lots of reading. So there's, as Dr. Banda has said, there's lots of journals now that are publishing all kinds of things. So before, it's very nice to say, I have a question, but then when you go on Google, you find that actually so much research has been done on that. But then you could still actually pick an angle to say, oh, but I can look at it from this angle. So reading quite broadly is very useful. So I think in terms of steps 1, 2, and 3, it's identify your interest, identify a mentor, then read a lot to try and refine your question. Thanks.
Thank you so much for that response. Our other question goes to Dr. Piri. Dr. Piri, what strides have you noticed in your field that wouldn't have been possible without carefully conducting research?
So going back to the issue of interest, so one of the fields I found interesting was the field of HIV cure research. So deliberately, I think, let me just one step back, plan out your career very well. Know what you want to end up being. So for me, I realized I wanted to learn something about vaccinology. So I found myself in Germany, in Heidelberg, spent a year there. And then when I came back, then I figured, oh wow, what's the biggest problem that we still have now? It's HIV. Can we cure it? And there is this small group, it's actually a small group of people who are doing HIV cure research. And in that group, tomorrow actually I'll be heading to Rwanda, because just a small group of us will be sitting to set an agenda for what we should be doing on how to find a cure for HIV within Africa. But without carefully conducted research, we would not have known that you can have broadly neutralizing antibodies that can neutralize the virus, sort of like kill it to some extent, make it ineffective. And recently in South Africa, I met a professor from Oxford who is working on what are called therapeutic vaccines, meaning that it's a vaccine that can both prevent and cure the HIV. But it's intricate immunology, getting T cells and making them go find the virus, reactivate it, do shock and kill, as we are called. So it's a very fascinating field, but it's deep. You need to think. You have to conduct careful research to actually get there, because the idea is, can we cure HIV? That's the point. Because yes, art is there, but there's fatigue in it. Can we have one day, a few tablets taken for 1 month, and that's it, clears the virus? So that's the field that I find interesting and that we're working towards heavily here.
Very interesting. Thank you very much for that. I just realized Heidelberg is the word I skipped in your bio because I couldn't pronounce it, but thank you. So the last question will go to Dr. Chiena, but before I can read the question, I would just like us to start preparing our questions, because right after his response, we'll get into the Q&A session. So the last question for Dr. Banda is, how do you balance clinical duties with research, and what advice do you have for students planning similar career paths?
Yes, so it's an important thing to balance your clinical work, especially those of you who want to practice medicine as well. So I'm heading a department as well as administrative and teaching. So the simple answer to that is you have to enjoy what you're doing. That's the key thing. So if you enjoy your research, you enjoy your clinical work, you are able to make time for both of them. Okay? And also deliberately plan out your career path. So you should know what component of your pathway you want to spend in clinical work, what component you want to spend doing research. And then prioritize each area and set a given time frame for each area. So typically, right now, my work, typically I start my day in the hospital, 7:30. We do teaching the MMeds, teaching the medical students in the mornings. I do my clinical work, and then I have deliberately Fridays. So usually Fridays is my research day there, as well as the weekends and after hours, after 4 p.m. So I do my research work in these time periods. So I've deliberately set time for research, deliberately set time for clinical work. But the most important thing is to enjoy them. And with research, there's a lot to enjoy because once you publish your paper, you know, it's a very satisfying thing for you personally. It means if there's a question on epilepsy, you alone have solved that problem for the whole world. And once someone goes online, they can search your name, it's there permanently. And when other people from East Asia, the United Kingdom, the United States are able to refer to your work, I was at a conference and people were talking, Banda invented this method of surgery. They didn't know that this Banda is actually just a Zambian seated there in the room. But it brings you a great sense of self-achievement, if I can call it that. So I would say pursue research, pursue your clinical work, but pursue it out of passion. That way you won't feel the burden on your life.
Thank you so much. I think research can be time-consuming, especially when writing the papers. So it's good that you've brought out the aspect of planning your time so that you can dedicate some time to research indeed. So we're now going into the Q&A session. If you've got any questions, you can ask. So we'll start from this side.
Okay, so I have 4 questions. I'm hoping that's okay.
No, I think one at a time, so you can just introduce yourself.
Okay, so
and who the question is directed to, or if it's to everyone.
Okay, so my name is Michelo Jehu. I recently graduated as well, and unfortunately, there were kind of follow-up questions, so I can't. Yeah. Anyway, I do love all your respective fields. Honestly, if it was up to me, I would be an expert in all of them. So my question, I guess the one I can ask is, since I can't ask them all, the last question being, in your opinion, and hopefully I'm not biased, which ones do you think are the most underrated areas in your field of research?
Well, I'll just give it a try. Underrated, a lot of simple public health counting things. You know, I think we see that even in our AMEDs where they're just like, oh, case studies of this one, they count, you know, we saw so many patients and this was, like, just, like, there's no nuance to it, like, you're not asking deeper questions to it. So I think surface public health gets to be underrated. That's my opinion. You said you asked for opinion, right?
Yes. Dr. Skile or Dr. Chihena, is there anything you'd like to add on that question?
So perhaps I didn't understand whether, do you mean underrated, like it's something that shouldn't be considered, or underrated, like maybe things that have been ignored in the field?
Okay, so underrated, like, it's not really being talked about now.
Okay.
Yeah, something like how you mentioned that HIV is still, the cure hasn't been found. But you find, not that they are not really talking about it much, but even in the media, the story is cancer, 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 but not really. So like, what do you think is not being talked about, but is actually quite the interesting field that should be talked about more?
Yeah, so I think in that regard, what I can say is it's not necessarily that things are not being talked about, but I think a lot of areas of research in Africa, like the HIV cure situation, is that we don't have the money, because the ones who have the money, that's what's heard. So because we don't have the money to drive research questions, to drive research, a lot of Africa-specific problems are not being researched. And so it's things to do like, so just recently, for example, in the field of epilepsy, epilepsy burden, you hear this in my lecture all the time, it's highest in our region. But our region is the one where you don't have all this access to treatment, you don't have access to money to do research. So you find that we even talk about the treatment gap, which is 90%. There are over like 30 anti-seizure medications now in the world. And when I go to a clinic in the UK, they just pick and choose whichever. But here, we're still using just the two. But we know there's effective treatments, but then at the same time, we haven't even tried to research to see, okay, what's working, what should we recommend? So it's not so much that the important questions are not there, it's just that our lack of resources and perhaps our lack of working together in the continent limits us from answering those important questions. And it's true across all the different fields, surgery, basic science, especially basic science, and yeah, neurology.
Maybe just to add on to that, I totally agree with what has been said before. So what we call tropical diseases, diseases unique to Africa, you name it from whichever field you're in, if you're in neurology, epilepsy, it affects, Africa and India, low middle income countries make up over 70 to 80% of the global population. But many of the diseases that affect us are barely, talked about, like, HIV, epilepsy. If you come for us, burns or road traffic accidents or chronic osteomyelitis. I went into Japan for over 5 years and never saw a chronic osteomyelitis. But here we see these things every day. The other personal burden for me is that when you open any single textbook right now, you find the chapter on malaria is written by someone in the UK who has never even suffered malaria. Yet you guys here who get bitten by mosquitoes every day, you've had malaria, you've drunk Coartem, quinine, Fancida. We can't write our own stories as Africans. So I challenged recently the Plastic Surgery Association, and I'm giving a lecture as well tomorrow to say, if you're going to have a chapter about how surgery works in Africa, burn care, I need to write that chapter because we live through these problems. So the challenge is not only because, European countries ignore us, also we don't tell our own story because we're so busy reading textbooks. So my challenge to you is that you have to become the storytellers for Africa. You have to be the ones to research the cure for HIV, for malaria, and write about these things through your research work. Yeah.
Thank you so much for those responses. And I would like to comment on the response by Dr. Chihena also. When we find it challenging when we're in dermatology, because when we search for a picture of a certain skin condition, whites will pop up, not someone of our skin color. So we don't know what a certain condition actually looks like in a black person. So it's up to us really as research being the future of medicine to research more and put up these pictures on the internet. Thank you so much. So the next question will come from the middle part. Section. Okay, I can see 2 hands behind.
Thank you very much. Good evening, everyone. My name is Masho Samson, a fifth-year medical student. So my question is simple. With regards to us medical students who are new to the field and talking about research, is the guideline for us to more or less focus on topics that are related to our future plans of probably, say, if I want to major into something related to cardiology. So should all of the research that I think about be directed there, or should most of my thinking be general because I'm new to research, so I should probably explore as much as I can in the field of research as a whole? Thank you.
Well, I think one of the quickest answers I can give is, first of all, follow your interest. What are you interested in? So even as you are starting, start where at least something there should be something in you, igniting you to do something in that area. At least be interested in it. And then find someone else who's doing it. It's important. I think association is so important. Find someone who's doing something you're interested in, and then the rest will be history. So how do you start? You can't be too specific. Sometimes things change. Like for some of us, I've done research in nanoparticles, where you form these small, tiny gold nanoparticles. And then from the next time, I'm doing vaccines. Next time I'm doing broadly neutralizing antibodies. But there's a thin line. There's something that is driving across it. It's coming up with interventions that can work in our setup. So find your interest and then find someone who's doing it and work with them.
Yeah, I 100% agree with that. I don't think when I was a medical student, I knew I was going to be a neurologist. I did have an interest in epilepsy still and this is really a personal thing because I have someone in my family with epilepsy. So even at 60, I did an epilepsy-related project. But I think when you're a medical student, it's okay if you've got lots of interests and you're not sure what specific area you want to go on, but just start. If something sparks your interest, do it. There will be no harm. If you've done a cardiac research, if you've done a neuro research, all those things will actually count. And the human body is one body. So all these things are related. Cardiac is related to the brain, is related to the lungs. So no one will say, oh no, you did lungs. You can't come to the brain. So I think as a student, just have your eyes and ears open and look out for opportunity. When I was a research assistant, I was helping an orthopedic surgeon. So it can be just quite broad. So keep it broad, but at the same time, have a goal, like an overall goal of where you hope to see yourself. So it's okay to have many interests, but pick an interest. Don't do something if it doesn't interest you at all. I think that would be, my comment.
So much. I saw other hands behind.
Good afternoon. I can see you people look like you have found your passion, your joy. From the way you are answering the question with so much joy, it's easy to see that you are enjoying what you are doing. But when I came into med school, I thought I knew what I wanted to do in first year. I was this excited student. But as time went on and I began to rotate, I started with peds. I thought I liked the kids. I went to surgery. I thought, I liked aligning the bones. I went to IMED. It was just exciting and overwhelming. By the time I realized I was in 60th year and I'm handling the book every after 2 months and all that, and you reach a stage where you are confused, specifically not with research, but how do you find your grip? Because in a few years' time, we'll be done, and then you reach a point where you have to select, and your mind is all over the place. So I think it's best you find your grip within the practice as you do your medical school. But I think it's confusing for most of us, where we are all over the place, and no, we are just confused, and you want to be everything. Thank you very much.
Did you get the question? Okay.
I think it's a genuine thought, and there is no, so you should stop thinking of life as a race. Just because, someone wanted to be a neurosurgeon from the day they were born, don't think you've fallen behind when, you haven't yet found your passion, Remember, this is something that you do for the rest of your life. So take your time. There's no harm in waiting, okay? So when I was, I think it was in my 4th year, when I decided, okay, I'm interested in plastic surgery. So I used to go and volunteer during my vacations, during CBE. I would join Dr. Goran and things like that. But I was not 100%. In 7th year, I enjoyed IMED as well. So internal medicine, it was very, very nice. I enjoyed it. And so going into my internship, I was 10%. But once we reached Kitwe, internal medicine was terrible. I decided, no, I'm going to become a surgeon. So leave yourself room to decide. If you're not yet comfortable with choosing your specialty, no harm done. But the other thing that, especially you, the upcoming generation of clinicians, doctors, researchers, is don't limit yourself. So when I was, there was no neurologist, there was no plastic surgery, there was no one doing high-grade virological research when we all started out at main campus, I think, together. So there was no one doing plastic surgery. So don't limit yourself to the little boxes that are set here in Zambia. So when we were doing, there was only internal medicine, pediatrics, general surgery, or obs and gyne. There was like 4 specialties, and maybe ortho was the new thing. But, we ended up taking different paths. It's not wrong, it's not correct, but don't box yourself to one thing. If you find in the future virology interests you, pursue that area. But take your time. It's not abnormal to be lost, okay? The other thing is also expose yourself. So if you're not yet decided, so most young people come to me, they finish their internship and we want to join plastic surgery. I tell them, no problem, that's really nice. Why don't you come join us for a week? When we're on the ward rounds, see what we do. You can join us in the operating room and then you can decide after you see if you like it or you don't, okay? So during this time, my challenge to you is, if you're not decided, take your time, but be active. Go and explore. You've heard about neurosurgery, virology. Come to the lab. We don't chase. See what we are doing when you have a free afternoon. You are doing your lunchtime. You're able to see the research is doing. You're able to see what she's doing in neurology, neurosurgery, dermatology. In Zambia now we don't have vascular surgeons. There are so many gaps that are there. But if you box yourself, you don't expose yourself, it makes the decision making much, much harder.
Thank you so much for the response. I hope your question has been answered. And just a reminder to keep our questions a little bit short so that we open room for other people to ask as well. So the last person to ask, please, you can go ahead.
Thank you very much. Actually, my question was very much related to what you asked because it's something we're discussing as we're coming here. I'll refine my question by asking it in this way. A lot of you have told us stories to say, during your time in med school, it used to be more of a one-on-one with the people that would teach you. Maybe you'd only be a group of 12 with a lot of doctors, but as it stands, in my class alone, we're over 500. Like he said, when I came, I also knew very much that I wanted to be something, but as the days have gone by, I don't even know where to see myself. So the question is, I want a mentor, but then at the same time, I don't want to waste people's time. So in a space where you're not sure where you want to be, because everything looks interesting, and at the same time, you can't be everywhere, where do you lean the decision? Do I follow Dr. Sukile? Do I follow Dr. Banda? Or am I just everywhere? Like, how do I make the decision so that at the same time, I'm not biased by taking your time away? Instead of you attending to other people, you're attending to me, who is at the same time not decided. Then the last aspect of my question is, our curriculum has actually been refined in the sense that we now have the shortened 6 years. When I was in my second year, I really wanted to come into 5th year because I thought it would be a year where I would have a lot of time, and maybe participate in things. But even the university itself would tell me, it's a no, you do not qualify to apply for this thing because...
Sorry, once again, keep your question as specific and as short as possible so that the speakers also not lost as you're asking.
Thank you very much. Okay, so my question in simpler terms is, looking at it to say the curricula has been refined, and the minimum qualification for someone to participate in most of the things is a degree. As a person who is undergoing the refined 6-year program, how do you position yourself for such things so that you are kept busy? Thank you very much.
Yes, please.
Thanks for the questions. So the first one about mentorship, I think it's important, and even I personally, and I'm sure my colleagues here as well, we understand that when you're a medical student, you're not a specialist. And even when the medical students come and rotate with us, I always tell them when they're doing internal medicine that you are not here to become a specialist, you're here to do general medicine. So even when we take on medical students as mentors, I'm not mentoring you to be a neurologist. I'm actually just mentoring you, say, if you are trying to do research, mentoring you in research, or if you want mentorship on the clinical side, mentoring you in that aspect. So a mentor doesn't necessarily have to be in your field. I've got mentors who are, say I'm in the field of epilepsy, but I have mentors who are in multiple sclerosis, for example. But they are very key in guiding me on how to write, how to plan grants, how to even think about research questions, even if it's not in their field. So I think at medical student level, if you identify someone who you think inspires you and you think you appreciate the path they're taking, they can still guide you even if your specialty is completely different. So I don't think that should make you feel afraid. I do agree that it's very challenging. It's different from when we were medical students. Our classes were very small. We were 60 in our class, the whole class. So, and you guys are 10 times that. So it really is a challenge. There are things, yes, that you need at least a qualification, like early career grants, for example. But you don't need a qualification to write a paper. You don't need a qualification to write a case report. You don't need a qualification to do a case series. And the thing is, when you're doing research, if you see publications, it's hardly ever one person there. It's always a group. So the first author is the one who's written, the last author is the mentor or supervising author. So even if you want to be a research, your supervisor can be the one who has applied for the ethics, and the one whose name is there as they've submitted the research. But when it comes to publication, you can be the first name there. So having a mentor actually helps cut those barriers of saying, I don't yet have the qualifications. Even applying for grants, your mentor can be your supervising applicant. So they'll apply on your behalf, but it will be your grant. So those are the ways. I think the key thing is to start identifying, and I know we say this, but it might be hard to identify mentors. In our time on Zameds, I used to have a mentorship program where they'll link students to doctors. I'm not sure if that's still going on, but I think that's quite helpful because, as you said, it can be hard for an individual to be a mentor, say, for hundreds of people. But there are so many other people, and usually we used to have like a matching system where you match interests with a student to the doctor. And then you take it like, and mentorship is even, it's a family. So you find like, I have a mentor, my mentor has a mentor. I remember one mentor drew a tree. They were like a great grandmother of people coming down, mentoring others. So even say a 5th year, a 7th year can be their mentor. Then the 7th year, an intern. And then that maybe say the MEd who has a consultant mentor can say, look, I'm mentoring this student, and you guide each other in that way. So medicine is a family, research is a family, so I think you can think about it like that.
Thank you so much. Is there any other response?
Yes, so I tell this to the 4th or is it 5th year classes when I'm orienting you. So, of course, there's a downside to being a big number, but there's also an advantage, and she's just mentioned part of it. Mentorship, of course, is vertical, but there's also horizontal. You can learn from each other. You can learn from your seniors, your 6th year, your 7th year. When we were, I think in our 5th year, starting clinical studies. I remember my 7th year, Dr. Sivanda Linus, and I would learn from him. In fact, a lot of the topics or tutorials, we actually used to discuss them with the 7th year. They would mentor you even how to do an examination, and the intern would mentor you, the registrar would mentor you. So you guys actually have this advantage. You have 500 other people to assist you in your journey. So don't lose out on that. Don't neglect your classmate. Don't neglect your 7th year. Then when it comes to finding mentorship, I think Dr. Piri really insisted on this one. You have to also push. So you never find Dr. Piri just maybe he's a good man, but where they're just seated and they have nothing to do. They always have something busy to do, but you have to show your interest. I remember when I wanted to do surgery, plastic, I went to go and he chased me from UTH and insulted me, but I didn't go. I just remained there. He went for 1 week, came back, you're still here. Okay, let's continue. Now you join surgery system. So be persistent. Don't give up easily. Follow your dream, be persistent with your mentors, and in the end, you get that response that you've been pushing for.
Can I just add something about not having a degree and wanting to apply for something? Find someone who has a degree. You do the writing. That's what we did with the mentee of mine. He had the idea. He did the draft. He sent it to me. We corrected it, put it in, and we got the funding. And other medical students have done the same. They've emailed, I want to apply for this grant. Can you help me? And we've sat down and said, let's correct the idea. Let's work on it. You're not qualified. Should I put my name there? I'll send you all the money. It's fine. You do the work. So don't limit yourself because you don't have the degree yet. I know we changed your curriculum because before 4th year was BSc, HB, and then MBC, HB, but now you don't have that. We had to do it for competitiveness sake, so that we can have 6 years. But that shouldn't be a limit for you. If you have the idea, find someone who has the degree, the qualification, you do the writing, they'll correct you, and then you move forward from there.
Thank you so much. I think all aspects of his questions have been tackled by each one of you. So we'll now go to this side. If you've got any questions, yes, please. I see 3 hands. So we'll start with Sophia, then we'll go to the others.
Good evening, everyone. My question goes to Dr. Asukile. As a woman in medicine, what would you tell your younger self about the challenges you're going to face and what you're going to do to overcome them?
That is a difficult question. And I don't know if there's anything that I could have taught myself that would really have changed. I think as what I've experienced as a woman is, it is difficult because I can't speak for the gentleman beside me, but it always feels like you're doing that extra bit more because apart from being the medical doctor, I'm also a wife, I'm also a mom. When you get home, there's that responsibility. If my husband is very, very good, but sometimes you go, the kids haven't bathed and so on. So there's lots of responsibilities that you have to do. And there's also always some guilt that's there, like, am I doing enough for my children? Am I providing enough for my family? So I don't think that it's ever easy. It's very difficult, and it's always a lot of sacrifice, but it's always a blessing when you have the support of your family, and you also try and communicate as much as possible, like with your partner, with your children. The one thing for me that I've always told myself, though, is I don't have to limit myself because I'm a woman. So even when I've had my scholarships, when I went to do my master's, when I got my scholarship for my master's, just before I went, I found that I was pregnant. So I waited and had the baby, but just when she was 2 months, I went and started my master's. When I went for my fellowship, just as I was going, again I was pregnant. I just do not know why it happened like that. But this time I was like, you know what, I'm just going to go. So I went, I did it during my pregnancy. So what I tell myself is life must just be lived. Like you work together with your partner, with your family, you make things work, but you just keep going. Because unfortunately, there is no time to say I'll stop and wait for this to be over. It will never be over. So you just have to keep pushing and keep going. You do have to find a way, though, to balance yourself and find some sanity. So taking time to rest, taking time to just exclude yourself from all the busyness, because your family does need you and they need your support. So I try as much as possible when I go and say, okay, from this time, no work, let me just focus. But it can be really difficult. But you shouldn't think of yourself to be limited. I remember when I was in high school, my teachers would always say, why is this girl beating you and whatnot? And that for me was just so annoying. Because I mean, you're just a human being like anyone else, but you're doing that extra bit more work. So yeah, just keep pushing and just keep going is what I can say. Yeah,
Thank you so much. Yeah. Unfortunately, the other two hands are not going to be, we're not going to ask the other two questions, but we are going to have a break where you could network and interact with the doctor you wanted to ask a question to, and they would answer. But because I'm the moderator, I have a question. So, yes. So you talked about being research assistants. I think that most people want to be research assistants, especially to people that are doing their research in UTH or anywhere. But I think it's the approach. They don't know how to approach these people. So what advice would you give to anyone who wants to be a research assistant but doesn't have where to start or who to identify as or who to work with?
I think the easiest is express your interest to any of us or to some faculty members, the lecturers. Usually we know who's got a project where. And so you'll be like, oh no, this student approached me, so can you include them? Just take the initiative, approach someone. Someone will tell us, oh no, I'm looking for this. Sometimes we're scrounging around looking for students to work with. But if you've shown yourself, you're available, you've told someone, I think it'll be easy to locate them.
Just to add to that, I think one other thing about being a research assistant, I remember, I think it was 60th year, I was a research assistant there was a big project on trauma. But my challenge to you is when you finally get that research assistant post that you've coveted, don't be too passive. So I was a research assistant with Dr. Martha Mukonka. She's a pediatric surgeon now. And we were just entering forms after forms after forms after forms. Yeah. But if you ask me today, what were you entering? What did you do? I don't remember. I just remember it was like 500 kwacha per form or something like that. Yeah. So that way I was just a passive research assistant. I didn't learn anything. Maybe I got 500,000 kwacha at the end of the day. But my challenge to you is when you finally get that research assistant job or post, be an active assistant. So find out what's going on in the research and try and learn the scientific part of it as well. Don't just end up being like us, just entering forms. You will miss out.
Okay, thank you so much.
So just to add to that, yeah, so for example, Emmanuel knows this. When I was doing that early career grant research I talked about, there were, I think, about 6 years who became research assistants. So these guys were research assistants, very active, but since then they each did abstracts from that work, which they've presented at conferences. They've graduated as medical doctors. Unfortunately, government hasn't employed them, but they are now employed under our neurology research team as research coordinators. So it actually helps, and while they are waiting for employment, they've got full-time jobs with our research team. So starting as that active research assistant, it can actually have a good future for you as well.
All right. Thank you so much once again to the speakers. Thank you to everyone who engaged with the speakers as well as everyone else was passive. Yeah.
Can I just say one last thing? Sorry. I just want to say one last thing, is that all of us here, Chihena, myself, Masalso, we were literally just like you guys. And when I was in 6th year, I would not have said this is where I'll be. So I just want to say that just start where you are. You are not behind, or even if you've never done anything, don't exclude yourself. I think my one goal, whenever I apply, I always apply. Whether I'll be rejected or not, if I think it's a good opportunity, include yourself. So it's just an encouragement that we were just exactly just like you. There's nothing extra special except maybe that we kept pushing. So just have that never give up mentality. Just find a goal and just chase it. And hopefully in 10 years, you'll be the ones speaking here as well.
But I can remember, I mean, Melody was really sharp, so. And then Chiena, very hardworking guys. I think this shows even when you're students, like your trajectory can be seen from way back. So right now, the way you are, if you don't change, is the way you will be. So I'm not surprised Chiena was in Japan for this long, Melody, where we've all found ourselves. It's those simple habits as students. So don't think anything will change if you don't change. That's what I'm saying.
All right. Thank you so much. So there's hope for the introverts. So unfortunately, as with all things, even the good ones, they must come to an end. And at this moment, I'd like to invite Mr. Zach Kafuko for the closing remarks.
Thank you very much, Emmanuel, Dora, Dr. Chena, Dr. Sokile, Dr. Piri. And none of these names are strange to me. I think if they dig down their memory, they should be able to remember my face or my name. So I think I don't want to take too much time, but just to mention that as an organization, this is exactly the value we see in these kinds of mentorship programs. We love to see people like the ones sitting in front of you share their experiences, give you a sense of the path, or at least the resemblance of it. And you can pick so many lessons from what has been said, what has been discussed today. And I could add a few if I needed to. But I think most importantly, as a mentorship program, I think Dr. Piri has really hit on that point on mentorship. Find someone whom you can work with, whether it's horizontal or vertical or whichever direction it is, but find someone that you can work with. Because the way we should understand mentorship is that it's not always about draining or sucking in knowledge or information. Sometimes mentorship is about camaraderie, trying to find someone who can relate, understand, provide that support system that sometimes you need more than the theories you find in the books. And I think that's very, very important. And there are other points that have been mentioned. I think one of the things that Dr. Asukile has mentioned, if you see an opportunity, go after it. Okay? There is a saying that closed mouths never get fed, right? So think about that and internalize it. It's not your job to doubt yourself. Your job is to sell yourself, all right? There are panels that are paid to doubt you, okay? Don't be on those panels, right? Your role is to write as convincingly as possible. Obviously, it has to be truthful and accurate, but don't deprive yourself an opportunity just because you're doubting yourself. Let other people do that, right? So pursue pursue and pursue. And the hard work concept of it that has, I think, both been spoken of and reported on about and from Dr. Chihena is something that you should, I think, also really value. Sometimes the perseverance and persistence that you present is actually the defining thing that makes you different. I think we've heard that he was, I don't know if he's insulted, but he came back. He had that passion, right? So if you really want to go after something, work hard at it and do not stop working towards that. The truth that I'm sure they will all agree with me is that no one really knows the correct and perfect formula towards success. We all stumble into success, all of us, right? Sometimes it's hard work, sometimes it's, mentorship, sometimes it's just you having the best belief system. To summarize, as an organization, we value mentorship, we value the mentorship program. And the theme for today's discussion on research being the future of medicine is very, very relevant. If you've gone to our website, you quickly realize that one of the things that we try to push so hard, and I think it also came out from the discussion, is trying to ensure that we promote local research in endemic settings. So we want to see more research being done by people in the locations and communities where these problems are. We want the answers to be pursued by people in those communities, in those locations. And that should give you an advantage as an individual. And this is also something that should continue to drive you as you pursue your goals. The point that was raised by Dr. Chihena, I have been, I think, in the position where he has been. And it's funny because he picked malaria as an example. And we are doing a lot of work on malaria. There are so many world-leading experts on malaria. Not to demerit their work, but the reality is that most of these have actually not had an episode of malaria. You have had this. You know family members who've had it. You know what it actually means when you're describing the symptoms, right? So find something within where you are. When you are planning for your future as best you can, a point that I think also I really appreciate being brought up is the idea of you being somewhat strategic. If you really believe that you want to be a person of impact or a change maker, it's up to you to decide when to begin to clean up your act. I think Emmanuel said, clean your digital profile, whatever it is. I've received emails before from, respectable people, but they set their email addresses when they were young, I think. All right? You receive an email from a very respectable person, and the email address is spicydoc@gmail.com. I'm not saying it's wrong, but I don't know how you interpret that. So think more about the person you want to become and begin to actively work towards that. And the last piece of advice I'll add is when you apply for scholarships or fellowships, it's very, very important that you know exactly what you're going after. And one of the things you need to do is do a lot of research before you apply. Know the organization you're applying to. Know what the fellowship is about. Understand the principle of the scholarship, because that's the way you get in. You need to know that. And I think Dr. Asukile really spoke very well on that point. We are trying to help young people like yourselves, young students like yourselves, to try and get into the research sphere. Lantilani, maybe some of you remember him. I'm being economic with the truth. You remember him. Right. We launched what we're calling the medical research micro grants. And we started with Unza Medsa. Now, the idea is just to do a lot of what has been discussed here, to try and begin to chart the way for you to think about those questions that you need to think about and begin to think about the steps that are needed. The truth is that research has a lot of mechanical parts to it. A lot of those. From mentorship, from the funding itself, from the questions you are asking, from the body of knowledge you're contributing to, and the gaps that remain even when you have seen them, because there's just so much, but you can't do everything. So we are trying to see how best we can help with that. And I repeat, as an organization, we have very, very keen interest in supporting local researchers, local research. Now, if you go to the higher level of the work that we do, we are working towards supporting and promoting medical and clinical research towards vaccine development, and especially for infectious diseases. We can't go into the discussion of non-infectious diseases, but the point being that we are very passionate about supporting that kind of research. And part of the problem, I think, starts here. Not a lot of you people are thinking about a full career in research. And the people in front of us who agree that Africa holds the world's highest burden of disease, unfortunately, but also the lowest medical research output globally. So you can see the disparity there. And how do we address that disparity, I think, is something for you to think about. In concluding, I just want to say once again, thank you very much to Unza Medsa for continuing to organize these kinds of events, and we remain committed to supporting these programs, even past successive executives. I think we've been doing this for a couple of years now, and we're happy to continue to do this kind of work. To our panelists for today, I think you've been very spot on, and thank you for sharing your experiences. And indeed, if we're going to improve the medical care or health care in Africa and reduce the burden, we need to start by answering the questions. And how do we answer those questions? It's through research. I think a funny statement that was given was, you can't be innovative about, dosing for Panadol, whatever it is, right? There's nothing more you want to do there. But there are questions that can be answered way back. Whether you want to improve the dosing schedule, whether you want to improve the quality or efficacy, whatever it is, but there are questions that need to be answered. So once again, thank you so much, and to our moderators for handling this panel with, grace. Thank you so much.